Good afternoon, and thank you for giving me the opportunity to speak with you today about priorities and opportunities for partnership with the American Academy of Pediatrics Autism Subcommittee. My name is Susan Levy, and I'm the chairperson of the AAP Autism Subcommittee. I'm also vice chair of the Committees for Protection of Human Subjects at the Children's Hospital of Philadelphia, a researcher in the Center for Autism Research, and a professor of pediatrics at the University of Pennsylvania. Next slide, please. During today's presentation, I will discuss the following issues. I'll give you a brief overview of the Academy's Autism Subcommittee. I'll provide some information about the upcoming revised Autism Spectrum Disorder clinical report, and I'll also discuss priorities for pediatricians and opportunities for partnership in the care of children with autism spectrum disorder across systems of care. Next slide. Before I speak more specifically about autism initiatives within the American Academy of Pediatrics, or AAP as I will refer to it, I'd like to provide a brief overview of the AAP for those in the audience who may not be familiar with this organization. The AAP is an organization of 66,000 pediatricians who are committed to the optimal physical, mental, social health, and well-being for all infants, children, adolescents, and young adults. To accomplish this mission, which is listed on the slide, the Academy is dedicated to supporting the professional needs of its members. Given the high prevalence of autism spectrum disorder in children and youth, about 1.5% of children, all pediatric primary care providers should be prepared to care for children and youth with autism spectrum disorder and their families. As such, the Academy is engaged in multiple autism initiatives to support the needs of its members and improve the lives of children with autism and their families. Next slide. This diagram represents the organizational structure and home of all autism initiatives within the Academy. All autism activities within the Academy fall under the auspices of the Council on Children with Disabilities, or COCWD, and the Autism Subcommittee. The AAP COCWD is a multidisciplinary council, and as such is comprised of nearly 500 AAP fellows, which includes neurodevelopmental pediatricians, developmental and behavioral pediatricians, geneticists, neurologists, orthopedic surgeons, physical medicine and rehabilitation pediatricians and clinicians, and general pediatricians, who all care for or have an interest in children and youth with special health care needs. Next slide. The purpose of the ASC Autism Subcommittee is to provide evidence-based guidance specific to caring for children and youth with autism spectrum disorder and facilitate its translation into education, practice, policy, and advocacy for pediatricians, caregivers, and the public. Objectives and priorities of the Autism Subcommittee fall into three categories: developing evidence-based clinical guidelines, education for clinicians, families, caregivers, and the public, and providing guidance and direction on policy and advocacy initiatives. Next slide, please. These are just a few of the partners of the AAP Autism Subcommittee, which include federal agencies such as the CDC, Centers for Disease Control and Prevention, and MCHB, Maternal and Child Health Bureau. It includes families and caregivers, AMCHP, Association of Maternal and Child Health Programs, AUCD, which is Association of University Centers on Disabilities, as well as other sections or councils within the American Academy of Pediatrics, such as the Section on Developmental and Behavioral Pediatrics and the Section on Home Care, among others. Next slide. A priority of the Autism Subcommittee and Council on Children with Disabilities is the publication of a new clinical report entitled Identification, Evaluation, and Management of Children with Autism Spectrum Disorder. This is a revision of two existing reports which were originally published in 2001 and 2007. The new publication will include a full report and an executive summary. Many educational initiatives to disseminate information from the report will be implemented by the subcommittee following its publication, including webinars, training opportunities, and publication of guidance for families, caregivers, and providers. Next slide. The report will include a comprehensive table of contents, which is listed here, listing key sections of the report, and have a link that will allow the reader to go to each section. Readers will then be able to click through each section in the electronic version of the report for easy access to information they are looking for. The new report will include increased recognition of families as therapeutic partners, as well as information about shared decision-making. Next slide. A key priority for pediatricians caring for children with autism is identification and diagnosis. This is a collaborative process between medical providers, schools, early intervention, daycare, community resources, social service agencies, and others. Therefore, it is critical for collaboration and coordination between systems of care to occur to assist the primary care pediatrician in proper early identification and diagnosis of a child with autism as early as possible. Next slide. Families report better quality of life when they feel more supported in the care of their child with autism. Family support may occur in various settings across systems of care. Pediatricians and the pediatric practice are just one component of a system that successfully supports families. Other components of the system that encourage and support families come from the state level, including but not limited to respite services, Medicaid waivers, community habilitation, crisis mental health and residential support, and others. Next slide. States and systems can support pediatricians as well as adult healthcare providers as adolescents and young adults with autism transition from pediatric to adult healthcare services. The degree of each type of service need will change over time as the individual develops and changes. Supports are required outside of the medical community, such as from each individual state, increase as families approach the transition to adult services. Next slide. Thank you for your time. This was a brief overview of the opportunities for partnership with the American Academy of Pediatrics for the care of children and youth with autism spectrum disorder. Please use the link on this slide to obtain more information and resource information.